you guys, it's Amanda and Janelle, and we decided to put together a really quick presentation on some of the questions that we're getting about vaccines and vaccine development. And so this is a frequently asked question edition, not on a Friday. It's just a special, thing to send you off for the break about the two vaccines that you've been hearing about in the news. So thanks for watching, as always. This one is the vaccine edition, and we just wanted to make a quick note. We are presenting this on December 23rd in the year 2020, and this presentation is a little bit more information heavy in terms of we've source linked to a lot of different information. And so if you are curious about any of the sources or if any of the slides represent things you want to know more about, we will be sharing this presentation with the email that goes out with this video. And so you can look at the bottom of the slides under comments and you can click on any of the links for the source material for the pages that we got that information from. So we're going to go ahead and get started.
Okay, so currently there are two vaccines that have been granted emergency use authorization by the FDA, and they're in the process of being produced and distributed across the United States. So the two vaccines are both mRNA vaccines, one produced right here in Cambridge by the pharmaceutical company called Moderna. The other one is a collaborative effort from Pfizer BioNTech based out of New York in Germany. For an analogy of how mRNA vaccines work to create an immune response in your body, please refer to the second half of our last Frequently Asked Fridays presentation.
Okay, so is there any substantial difference between these two vaccines? So a couple of differences, but nothing really huge. Both vaccines have been approved for 2 doses, and early studies have shown that with 2 doses of the vaccine, you can have over 90% efficacy in protecting those who are vaccinated from infection with SARS-CoV-2, which is the virus that causes the COVID-19 infection. Moderna has been approved for use in those over the age of 18, and the 2 doses are spaced apart by 1 month. And then Pfizer has been approved for those who are over the age of 16, and the 2 doses are spaced apart by 3 weeks.
So we're going to go over the ingredients and contraindications for people and reasons why they shouldn't get vaccinated. So both vaccines contain the synthetic mRNA material along with a couple of other ingredients. So we do recommend that you talk to your doctor before receiving one of the vaccines if you fall under the following categories. So if you've had any allergies, if you have a fever at the time of your vaccination appointment, if you have a bleeding disorder or you're on a blood thinner, if you're immunocompromised, or if you're on medication that affects your immune system, if you're pregnant and planning to become pregnant, if you're breastfeeding, or if you've received another COVID-19 vaccines. At this time, both vaccines are not recommended for those who have a history of severe allergic reaction and carry EpiPens. I also just want to highlight that neither of these vaccines use aluminum or thimerosal as preservatives.
So what is the timeline for vaccine availability to school personnel? This material is from the mass.gov website that's about the vaccine rollout. In phase 1, they prioritize people who have the highest contact and the highest risk level for COVID-19. So those are clinical and non-clinical healthcare workers that are doing direct COVID-facing care. So people who are working directly with those who are infected. People who reside or work in long-term care facilities, police, fire, and emergency medical services, congregate care settings, which includes corrections and homeless shelters, home-based healthcare workers, and healthcare workers doing non-COVID facing care. These people are all in phase 1. Some of them have begun to be vaccinated here in Massachusetts starting in December. That's really exciting. And phase 1 goes through December through February. And then phase 2, all of these are listed in the order of priority, are going to be individuals with more than 2 comorbidities, people who work in early education or K through 12, transit and grocery workers, utility, food and agriculture, sanitation, public works, public health workers. So that's where we would fall. We would fall right in the middle there of phase two. Also, adults who are 65 plus and individuals with one comorbidity. And that is February through April. And then phase three, when the vaccine is available to the general public, they say would be April through June. A lot of this timeline depends on how many doses of the vaccine become available and when the vaccine workforce is available to be mobilized to get those vaccines out to the people and vaccinate either in pharmacies or on site where people are working.
So the number one question that I'm seeing a lot of people ask is, can we trust a vaccine that was developed in less than a year? And the short answer is yes. Early data on both of these vaccines are very promising. These two vaccines are well-funded and well-coordinated in recent public health history. And although these particular mRNA vaccines have been around a short time, it represents new advances in healthcare and in science, and researchers have been working on mRNA vaccines for decades. And we owe much of our understanding of synthetic mRNA vaccines to a scientist named Catalin Carrico, who began studying mRNA in 1990. And she also currently serves as the Senior Vice President of BioNTech.
So let's look here at the timeline of vaccine development, and we can talk a little bit more about that question on the last slide. So this vaccine was developed within a year, which is amazing. And I think just goes to show that our scientific community can do amazing things when they work together and when they're well funded. In January, the SARS-CoV-2 genome was released. So scientists in China, where the pandemic began, were able to genetically sequence this virus. Genetic sequencing of viruses is new. It's based off of our huge advances in genetic technology, and really has helped us to understand the spread of diseases and helped us to be able to really coordinate a lot of these advances in technology. But anyways, that was amazing. And the scientists in China said, you know what, this is something that everybody needs to know so that everybody can work on developing vaccines. And they released that information. They did not keep it to themselves. Preclinical trials from the Pfizer and BioNTech vaccine were able to begin 3 weeks after they released the genome from SARS-CoV-2, which was awesome. So the preclinical trials were the initial safety trials. They started manufacturing the mRNA, the synthetic mRNA, and they started using it on cells and in animal trials. In this case, the rapid development of the Pfizer and the Moderna vaccines were greatly aided by that international coordination and by the international community. Also were greatly aided by the funding, the rush of funding, as internationally governments notice, you know, we're really not going to be able to return to normal until we can provide some form of vaccination. And so governments themselves were funding vaccine research and development. It was also aided by the fact that mRNA vaccines can be put together and manufactured very quickly. So an mRNA vaccine is a little bit different than some of the other vaccine technologies that we have, like vaccines that use vector viruses or vaccines that are live or attenuated or use particles, virus particulate. They can be manufactured much more quickly. And so Pfizer and BioNTech were able to begin phase 1 and 2 clinical trials towards the end of April, beginning of May, and were greatly helped by that ability to be able to manufacture the vaccine so quickly. And then they were also helped, although this is, you know, just goes to show the times that we're living in. The vaccine companies were helped by the fact that infection is so widespread. And so once you get to phase 2 and 3, and you're doing those clinical trials that use, over 10,000 people, you need to be able to see that a certain number of those people have been exposed to the virus, and you need to be able to see their response. And so in phase 2 and 3, towards the end of July, beginning of August, both Moderna and Pfizer, Moderna was a little bit behind Pfizer, were able to see, not only did the people who were enrolled in the vaccine have a good response to it, but they were able to calculate these numbers rapidly because we have such widespread infection. So we were greatly helped in this development of these vaccines, even though it just reflects how widespread the infection is and how much of a strain this has been on everybody and on our healthcare system. But it does, I want to throw out a distinction there because they've previously studied mRNA vaccines, some of which were in development following the SARS outbreak and the MERS outbreak, but they weren't ever able to get to that really big phase 2 and 3 clinical trial because those outbreaks were contained. They were contained to a geographical area and they were contained to smaller numbers of people. Let me just look right here. Yes, so I think I hit on all the points. So we were aided a lot by the sharing of information, by the releasing of the genome. We were aided by how quickly mRNA vaccines can be formulated and can be kind of mass produced. And we were aided, even though it's not great, by how widespread infection is.
Okay, and we also want to highlight there's much more to come and that this is just the beginning of the vaccines that are going to come out, especially in the midst of a global pandemic, like Amanda mentioned. So there are ongoing safety studies and information being collected by Pfizer and Moderna vaccines, even as it's being rolled out for those who are at the higher risk of infection. There are also other vaccine candidates that are continuing to run clinical trials, and we can anticipate that we will have better options and more options as this rapidly evolving public health crisis continues to unfold.
Okay, so we just want to say thank you for your questions, for all of your hard work this year, for all the ways you guys are working to keep our community safe and healthy. We want to wish you a happy new year. We are hopeful for things that are to come. We are excited, for many of the amazing things. And we know that a lot of the people that we work with are some of the best out there. So thank you guys so much, and we'll talk to you in the new year.